divine healing in the mighty name of Jesus. Now, very quickly, to save our time, I'll go ahead to introduce our guest speaker for tonight as we prepare to hand over to her to go ahead with the presentation. Dr. Oge Ilegbuni. I'm sorry if it is not well pronounced, ma. She's a UK qualified general medical practitioner, and she worked in the UK for about 14 years before relocating to Nigeria. In her current role as the Director of Medical Services and Principal Clinician at DAMC, she's the Head of Strategy, Development and Outreach at the Lakeshore Cancer Center, where she leads on development of innovative and creative ideas in driving the preventive health message, particularly in resource-poor environments. Also in her current role, she is keenly focused on spearheading the eradication of cancer in Nigeria with immense passion and enthusiasm. Please join me tonight as we bring on board Dr. Oge. Thank you so much, Ma. The floor is yours.
Hello, thank you so much, very much for that introduction. And thank you for, inviting me to share and spend the evening with your group. Thank you to everyone who's here and those who will join us soon. I laughed a bit when you said, for someone who's seen it all, not seen it all at all. And even in this space that I'm in, every day brings its own, something new, something for me and for my colleagues to learn every day. It could vary from clinical to non-clinical, incidents, and just engaging with groups like yours is also learning. I'm probably going to have questions or comments that will get the brain cells going as well. So I'm not looking at this as a lecture. It's more interactive. Quite all right, I have some slides, but I'm not going to spend too much time on the slides so that we can then go on to some interaction. You mentioned that you don't want this topic to be something that would alarm people, something that would generate fear, because of course, the C word, when people hear the word cancer, it's almost like there's no hope, which actually is not the case. And in a way, my talk today is really for us to navigate that fear, navigate what we should be doing. And so that at the end of it, at the end of the engagement, people can go away and sort of look at it from a different perspective, a different context, and be able to tell others as well that, hey, cancer is a disease. It's not good. We're never going to consider it a good thing, but these are the XYZ of how you can navigate, whether it's prevention, whether it's screening, and if there's a diagnosis, how to navigate treatment and what to do. We live in a very fearful society, despite the amount of prayers and, religion that we have here. Actually, there's a lot of fear inbuilt in the system. And so it's an ongoing process for us to just continue talking about it, destigmatizing things like cancer, things like mental health, things like sexual harassment and rape, things like domestic violence. These are topics that have always, or issues that have always been, swept under the carpet. So the fact that we are here on an evening, a Saturday evening, when I'm sure you could probably be doing other things, is an indication that everyone is thinking of this from an angle that it's a topic that needs to be spoken about. So let me see if I can actually share my screen. I always sort of have an issue when it comes to sharing my screen. So I think I sent some around my so bear with me. Let me see. Can you see? Not sure.
Not yet, ma.
Not yet. Okay.
Should I go ahead and share here?
Okay, maybe if you do that, so we don't keep everybody sort of waiting. I'm just trying to exit what I'm trying to do now. So,
Can you see my screen? Huh?
yes,
Yeah.
yeah, we can. Okay,
Okay.
just give me one more. Just give me a little time. Let me see if I can share it, because then I can guide it better. If that fails this time, then yeah. So just give me. I think that's it, right? Can you see?
Yes.
I need to get it onto slideshow
Okay.
so that it's see now. Is it
Yes.
is it on? Yeah.
Yes, it's on slideshow now.
So I don't want us cheating. So I'm just going to throw it out there. What is cancer? Is there someone who can just very quickly tell me what they are thinking when the word, it doesn't have to be a perfect description like a dictionary meaning, just it could even be the sense of what you feel when that word comes across, whatever, whether you're reading about it or you're discussing with someone. So in your own words, just let us know, what do you think? Victoria, you want to try as our host? When you think of the word cancer, what do you think?
So I sent it in the chat, the growth of abnormal cells.
Okay, all right. And then in terms of how you feel when you hear that word, how does it make you feel? How does it make you feel? You're still muted.
I would say fear. I would say sometimes you can't really say what the cause is because there are so many causes. So yeah, that's all.
Okay, so you did get that correct. Thank you very much. It's the growth of abnormal cells. So already we know that, we are made up of cells. So that's the human form, very minute down to the, detailing of how we've been formed. Cells make us up. And normally these cells go through the same cycle of living like we do as full human beings. You're born, you grow, and you die. Nothing fearful there. That is the way it should be. That is the cycle of life. And at the cellular level, that is actually what happens. So you then have situations where these cells do not actually obey that order of things, and they just start growing abnormally, a bit like losing control of your brakes when you're driving. And these cells are just there proliferating, and they are abnormal both in looks, abnormal both in function, because when people think of cancer, they are thinking of the lump. We always say, oh, lump, a tumor. But actually, that is one in what we call the solid tumors. You also have non-solid tumors that are not just, the problem isn't just that the cells, you can feel them, but they're also abnormal in the function, the activities they should be carrying out. And now, these cancer cells, if they only stayed in the area where they are found, so if it's breast, if it's prostate, if it's the bowel, if it's the skin, then no problem. The doctor just goes in there, the surgeon, takes it off, and that's the end of the matter. But these cells also have the ability to leave the area where they originated from and spread. And that's what I have here. It says cancer cells have the ability to invade and damage normal tissue. So where they are, they will invade and damage it, and then they will leave that area and go to other parts of the body. And I think this is the process that is most alarming, because the ability to spread means that there is a bit more challenge and difficulty in trying to, contain it. And that's where the problem comes in. So in Nigeria, we have, not just Nigeria, actually, when you refer to the big four are the cancers that have been identified that are not just prevalent, they are not just common, but actually they are, you find that they are also the ones that you can screen for and that you can put in a lot of preventable measures. So anyone who can tell me what these four cancers are? Anyone who can tell me what the four cancers are?
One can try with two.
Okay, please go ahead, Olushina.
Prostate and breast.
Okay, prostate and breast, great. Those are 2 out of 4. Anyone want to fill up the other 2? So we have prostate and we have breast. Okay, I'll help out here. We have prostate.
We also have leukemia, which is of the blood.
Okay, so leukemia is blood cancer, but it doesn't fall into the big 4. It's not as common as the ones that we're referring to. So do you want to try again?
Ovarian cancer?
Not as common. Something close to ovarian. It's a female cancer. Cervical cancer. Have you heard of cervical cancer? HPV, vaccination, it's beginning to catch on. So, and then the 4th, I think I mentioned it unwittingly earlier, bowel cancer. So we have breast cancer, we have cervical cancer, we have prostate cancer, and we have bowel cancer. So prostate is a male cancer because only men have prostate gland, women don't. And then you have breast cancer and cervical cancer. And even though they are considered to be female cancers because only women have cervix, the cervix is the mouth of the womb through which, your menstrual flow, through which the baby comes out. However, you cannot categorically say that breast cancer only affects women because actually men can have breast cancer. It's just that it's rare and it doesn't manifest the way the women's cancer, breast cancer, because we have breast tissue. Men don't have breast tissue, but they have the breast buds, and that is where the cancer can start from. And unfortunately for the men cancer, by the time it's discovered, it's actually spread because men don't necessarily have, a woman would feel their breast, their partners, whether your husband or your boyfriend will feel your breast. There's always something driving you to the breast and you notice if it's unusual. Men don't have the physical, attributes that would point out to them that something is going on. So men, if there's something you can take away today, you learn that men can actually have breast cancer. So breast cancer, cervical cancer, prostate cancer, and bowel cancer can affect both men and women. Colorectal cancer is the same as bowel cancer, your gut, large intestine. Okay, so another thing we should know is cancer staging. It's very important. You sometimes hear, a few of you might have heard, oh, and this patient, they said she was stage this or stage that. What does it actually mean? And that is very important because cancer staging at the time of a diagnosis is what you're going to use for treatment for the doctor. We need to know the stage to be able to identify what we are going to treat with. So You've got stage 0. Stage 0 is the perfect stage. And there's no cancer, only abnormal cells with the potential to become a cancer. And this is where screening comes in. When we talk about screening, we are talking about apparently normal, well, you don't have any symptoms. You've just gone for the doctor to do your regular breast check. You've just gone for the doctor to do your mammogram, which is X-ray of the breast. You've just gone for the doctor to take a blood sample to check your prostate. You are well. This is just your regular check. And then they discover, oh, you have got some abnormal cells in there. And immediately things can be done at this stage. It's not even a cancer. It cannot be called a cancer. That is the beauty of screening, early detection. Again, you have stage 1, which is early stage. So this time, again, usually found during screening as well. The cancer is so small and in that one area. So if it's in the breast, it is very small. It's not gone anywhere. It's not damaged or invaded even tissue around that area. And it certainly has not spread. Again, beauty of screening, this is when you also want to get any cancer, if at all. Now, stage 2 and 3, by then, you can feel that something is wrong. It might be that you've noticed that your breast is a bit bigger. It might be that you've noticed that sometimes when you pass urine for the men, you're noticing some changes. It might be that when you have sex, immediately after sex, you have some bleeding, some spotting, which never used to happen. Again, this is for the cervical. It might be that you've started noticing that when you go to the toilet, sometimes you're constipated, sometimes you're having loose motions, stage 2 and 3. And in this situation, the cancer is larger and is beginning to grow into the nearby tissues and lymph nodes. And most times it's not usually in screening. The person can tell that something is going on. And then we have stage 4. Stage 4 is the more difficult stage, the stage that we call advanced, because the cancer, so using the breast again, the cancer has left the breast. You can now find the cancer cells in the liver, in the lungs, in the spine. And unfortunately, because our society of fear, where people don't go, they don't seek attention when they notice something is wrong. Also because of the lack of awareness and education by the government, there's no national program. Most patients actually turn up at the doctors at stage 4, when it is a lot more difficult to, you're not talking about cure here, you're talking about containment, quality of life. You're trying to go through treatment that would minimize, but not necessarily cure the patient. And that is the whole idea of just talking, trying to dispel the fear that people need to come at stage 0, stage 1. People need to scream so that if there's anything, as we say, God forbid, but if there's anything, it's caught so early that, by the time your treatment is done, you have a normal life going. So this is the way it looks: stage 0, stage 1, stage 2, stage 3, stage 4. So you can see it's getting deeper and deeper. This is a cross section of the breast that has been taken just to show how the stages, how the cancer looks at every stage. So I've already referred to screening, and screening refers to tests and examinations that you use to find, you're trying to find disease in people who don't actually have any symptoms. And I know we have this philosophy that has been propagated by, the religious. And this isn't pointing fingers at the religious, because quite a few churches and mosques and religious institutions are actually advocates of screening, advocates of education and awareness. But we also have this sort of penetration into society where you tell people, have you had your regular health check? This doesn't even have to do with cancer, just going to check your blood pressure, check for diabetes, and people just tell you it is not my portion. And my question usually is, and whose portion is it? are we suggesting that the people who come down with diseases of any sort have done something that means that they've been punished for something, and that is why they've come down to, to having an illness? So I think we need to be careful when we utter a lot of words or expressions that in a way affect our mindsets. When you say to people, have you done your screening? They'll tell you, no, they haven't, because it is not my portion. Doesn't make any logical sense, but it makes sense to the person who's saying it, because they've said it, often enough to believe that. And that is one of the core things that affects us in this country. Now, the goal of screening tests is for cancer, is to find it before it starts causing symptoms. So breast cancer found during screening would likely be smaller. We've seen that, and confined to the breast, so that the doctor, the surgeon, the oncologist then have to deal with just sorting out the breast, and that's it. So again, people ask, so what do I do? How do I begin the screening that you're talking about? So let's take breast cancer, for instance. The screening guideline means that from the ages of 16 to 18, it could even be younger. As far as you have breasts that you can see, you're wearing a bra, you can touch. Everybody, every woman on here should be breast aware. And women should become familiar with how their breasts look. And the only way to do that is that you examine yourself at least once a month. You know how we look at our faces, when you have a pimple, when you have hair, when your eyebrows are looking bushy. It's the same way you should get to know when something unusual is happening with your breast. And the only way to do it is looking at the breast, touching the breast, palpating the breast, making sure that you know what normal is for you. So the American College of Radiology then says that from the age of 40, women should then start a yearly mammogram. A mammogram is an X-ray of the breast. So you check your breasts every year, every month yourself. Every year you go to your doctor, someone like me, and I examine you. And then once you turn 40, you then start having X-ray of the breast, which is called the mammogram. But if you have a family history of breast cancer, so you've had a mother or a sister or a mother's sister, there's a strong history of breast cancer, then you actually need to start doing that mammogram earlier as well. So I've just mentioned, when is the best time for you to do your breast examination? Do it after your period, because if you do it just before your period or during your period, for the women here, you know that the breasts begin to have a bit of hormonal changes. You notice that the breasts are a bit heavier. For some people, it's a bit sore. So we said, do it once your period stops, about 5 to 7 days after your period. Some people do it a bit earlier, depending on how much the breasts feel. And then for those who have gone through menopause, in other words, you don't have a period anymore, so you can't use your period as, to set your examination calendar. You can just choose the same time every month when you want to do it. So that is a description of how you do it. You check in front of a mirror, you examine, you lie down, and you check. Just to make it easier, go on to YouTube for the women here, even the men. You can go on to YouTube, see what a self-breast examination looks like. You have the men on here, you have sisters, you have mothers, you have wives, you have girlfriends. Keep up the good work, keep talking to other people, and you have friends generally. So again, what are you looking for when you're examining your breasts? You're checking for a change in the size and shape. You're checking for redness or rash. You're checking for discharge from the nipple. You're checking for swelling in the armpit or around the collarbone. You're checking for lumps, which is what people usually focus on when they think of breast cancer, lumps. But actually, breast cancer can manifest in any of the ways I'm mentioning now. You can check the skin texture, you can check the nipple. Most women might have their nipples inverted, meaning that, everted, meaning that they are usually out. If you notice that one suddenly is now permanently in, that's a cause for concern as well. And you can check, pain is actually one of the rare symptoms of breast cancer. Most people with breast cancer actually do not notice pain as one of their early symptoms. So if you have breast pain, see your doctor. The chances are you might have improperly fitted bras. It could be some other thing. It might not be breast cancer. You see your doctor for any examination. So again, this is how you examine. It tells you the different stages, the different steps, what you do. But again, please go to YouTube. All this you'll find there. So this is a clinical breast examination that I would normally do. Again, a doctor or a nurse can check this for you. Just bear in mind that if I'm checking it, you won't be wearing a bra. I think this was just for the sake of privacy for the person who was having that done. And then we talked about mammogram and how the mammogram is a standard approach for screening. It's an X-ray, and it's a good thing to do as women get older and the breast tissue is not as easy to palpate as normal. So now we can talk about cervical cancer. Let me just go back. Can I just ask anyone who can talk to us about whatever they know in relation to cervical cancer screening? Anyone care to share? Please, it doesn't have to be a perfect definition. What do you know? What have you heard in relation to cervical cancer? Don't feel self-conscious. We're all here to learn.
I think for cervical cancer, once a girl or a lady becomes sexually active, then once in every 3 years, you should go for your screening to detect, because it's one of the hidden form of cancers, and before it's usually detected, it will have been in the advanced stage. Yes.
Okay, good job, Victoria. Good job. Anyone else? Do you have anything else to add? Anyone else? That was a really good start. Okay, so we already mentioned earlier that the cervix is the mouth of the womb. It's deep, 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 up there. You go through the vagina, it's high up there, protrudes, a tubular organ, it protrudes into the vaginal space. And that means, unlike the breast, you cannot actually feel it. Even when you're washing yourself and all, but most people don't go that high up, if you know what I mean. So just like Victoria mentioned, it is one of those cancers that you don't really notice much because it's not out there. It's not in your face until you actually start having symptoms. And with cervical cancer, by the time you start having symptoms, it actually means that we're not talking about stage 0 or stage 1 anymore. And so screening is really it's one of the cancers that screening is so important, because the heartbreaking thing is that early detection of cervical cancer, it is one of the most easily treated cancers, actually. Very responsive. You can even notice when the abnormal cells are there and you treat it, it doesn't come back. You don't have the recurrence rate for cervical cancer is not as high as a lot of cancers. And so it's a bit sad that it's one of the cancers that is still being ignored. So what causes cervical cancer? Can someone share? What do you think? There's something else that has been mentioned in this day and age, and everyone is like, oh, have you got that? Have you got that? Has anyone heard about the human papilloma virus, HPV? It's a virus. Okay. So human papilloma virus is really a harmless virus that, it exists like any other virus, but it is a cause of cervical cancer in 99% of cases. So for those who are good with maths, you do the maths. It just means that, most cervical cancer patients would have had exposure to HPV. Now, 1% will now be caused by other causes of cancers, whether it's, obesity, whether it's smoking, whether it's heavy alcohol intake, poor diet, but 99% would be this virus. And this virus is very common. Most of us who are sexually active would have been exposed to the HPV through sexual intercourse, but it's not an STD. It is just a virus that is picked up, it's on the skin, and can be transmitted between partners, whether it's female, male, or male to male, or female to female. And what it then means is that usually the body clears this off. If you have a good immune system, you will never even know you had a HPV exposure. The body just clears it off. It's a bit like when you have a cold and a cough caused by a virus. Sometimes you never even end up taking antibiotic. You just take your usual hot drinks, vitamin C, and your immune system does the rest, and it shakes it off. And HPV virus is similar. However, in some situations, you then find that it is not cleared. The virus persists in that cervix, and when it persists, it then starts causing changes in the cells of the cervix. And the changes in the cells of the cervix will then continuously progress. By the time it's stage 0, then stage 1, and then it's a cancer, and you keep going. And the sad thing is that from that exposure to the HPV, where it starts causing changes, it actually takes about 3 to 7 years for it to be an outright cancer. So imagine if the patient, that woman, had been doing a 3-yearly cervical screening, just like Victoria mentioned, it would have been picked up long before it became a cancer. And that is one of the heartbreaking things about cervical cancer. So cervical cancer screening is twofold, but we'll start with the prevention, because part of the discussion is also about prevention. Preventing cervical cancer boils down to taking the human papilloma virus vaccine. There is a vaccine for it. So just like when you're a baby, when you're a child, you take your measles vaccination, you take your BCG, and then as you get older, you start taking things like your hepatitis. HPV has a vaccine, which is obtainable in the country, is there. And the suggestion is that you start taking it from the ages of 9 years right up to 45 years. You can take the vaccine within that time frame. The earlier, the better. The earlier you take the vaccine before sexual activity, what it means is that it builds up, the antibodies are built up, and as soon as you have exposure to HPV, your immune system recognizes it. I know this virus, and off it goes. So your immune system gets the additional boost with the antibodies by getting the vaccine. So that's prevention. The other prevention will be the usual prevention that when we talk about cancers in general, and I'll mention that later. Now, you've done prevention. How about screening? So again, there are 2 forms of screening that are done for cervical cancer. One is the actual collecting the cells from the cervix. It's called either pap smear or liquid-based cytology, or checking for the presence of HPV in the cervical cell. So we do that at the clinic. You present yourself, we go in, it takes less than 2 minutes from when you lie down to when we actually go in. And we use a brush to collect samples from the cervix. And then we send it off to the lab. So that's it, all done. There's no injection, there's no anesthesia, very fairly straightforward. You collect the sample and you go off. And then we wait for the results to come. And how often should cervical cancer screening be done? If you do the pap smear or LBC in addition to the HPV, then the testing is not, it goes beyond 3 years. But if you're only doing the pap smear, then just as Victoria mentioned, you have to do it a bit more frequently every 3 years. And I just want to emphasize that these things are happening in Nigeria. It's right here in Lagos. We do it at our facility. It's done in other facilities, whether it's hospitals, some NGOs. It's done at some primary healthcare centers. It's done at loose. So this isn't something that is a case of, oh, okay, we are just bringing Oyibo tests here and talking about it. It exists. They are very obtainable and they're affordable within our environment. The only problem is that there's no national program. The government is not talking to people. It's not out there. And so most people don't know. So this is what it looks like. That metal, so you can see the hand of the doctor or the nurse introducing this metal in through the vagina into the cervix, and then it's kept there. You can see the brush at the mouth of the womb. You can see the uterus is also called the womb, the uterus. And you can see the arrow going to the part, which is the womb, which is the cervix, the very mouth. And this brush is rotated 360 degrees several times, and you collect enough samples. You take out the brush and you take out the speculum, and that's it, you're done. So I think we've done the women. So to go to the prostates, I would like a woman to answer this question. What's the prostate? So let the men not answer. I would like a woman to answer this. Where is the prostate gland? Where is the prostate gland? Try. Guesswork is allowed. Guesswork is allowed. Somebody has unmuted. Please go for it. Come on. There are 22 people on here. 22. That's a good number. So I expect at least to hear one or two voices to this question. Okay. The men, where is your prostate? What is your prostate? You do know you have a prostate, right? Hello. Can I get the gentleman who answered earlier? Oh, okay. Someone's coming.
Prostate is the gland underneath the penis that contains the semen.
If it's under the penis, then it suggests it's external and you can see it. So I would have to decline that, but good effort. Thank you for at least trying. Okay, anyone else?
I think it's below the bladder.
Okay, yes, it is below the bladder. It's like a nut, like a walnut below the bladder, hugs the neck of the bladder. Okay, so I'm trying to see if I had any pictures for it. Yeah, I didn't. You can check later, go online and check. You'll see how the prostate gland nestles, is hugging the neck of the bladder. Okay. So again, for the men, what happens is that this prostate, you know, somebody has mentioned all the things that come through there, the semen and all that. But importantly, by virtue of the geographical location, the prostate is very close to the function of the bladder, in the sense that as the prostate gets larger, as men get older, it constricts the bladder, meaning that the urine doesn't flow as well. And even though the men tend to have a normal enlargement of the prostate gland as they get older, what also happens is that when there's a cancer in that prostate, it can also get larger. So any man who notices any symptoms relating to their urine flow, urinary pain in their back, that sort of thing, they need to see their doctor to check and see what's going on with the prostate. But as part of screening, again, like the cervix, it's not a gland that you can actually examine easily. You as the patient, you can't really feel your prostate, but I as a doctor can feel your prostate. I examine you through the back side, and I can palpate your prostate. So apart from that, palpating your prostate to see if it feels large, if it feels normal to my fingers, there's a blood test called the PSA, because the prostate produces a protein that can be detected in blood. So this PSA is done by a test. And because our Black men have a very high, it's something that is quite common in our Black men. It means that this is a test that has a guideline. So we say that when you're in your 40s, your early to mid 40s, you should actually start having your prostate checks done. Again, in Nigeria, there's not enough noise about this, which then means that, referring to our staging, most of our prostate patients are coming in stage 3, stage 4, when they already have symptoms. But if they were checking, then it will be detected early. And again, prostate cancer is very, very receptive to treatment. It means that, the prostate issue would be sorted. Just to note that you can have a high prostate level in some other conditions. And that is why I always advise people this Nigerian habit of just going yourself to a lab to do tests without the guidance or discussion with a doctor is a very dangerous practice. Or just going to a pharmacy and prescribing drugs for yourself, self-medication. It's been the cause of death of so many people. Everyone should be registered under a doctor, whether you're using the doctor or not because you don't feel well or because you feel well is not actually enough excuse, because the whole idea is you're registered with a doctor. By the time you're in your 30s, you should be having annual checks every year, whether you're well or not. You should. Healthy people should have health checks. And then by the time you're getting into the stage where you become hypertensive, diabetic, and all these other issues start coming up, it means that you have a trusted doctor, a trusted hospital, a trusted clinic that you can quickly go and seek advice and guidance. Then you don't have to be the one going to the lab and guessing at the sort of things you should be checking, because it's difficult to manage yourself. You should have someone who is trained to do that. So I'm just using this opportunity to say to people, please, if you do not have a doctor that you're registered under, Monday, go and do that. You do not have to be ill or dying to have a doctor who takes care of your health when you need it. So that's what happens with prostate. The last one is your colorectal bowel screening. Who can tell us what could be the reason for the rising cases of colorectal cancer in our environment? Some years ago, 10, 15 years ago, we hardly had cases of colorectal cancer in our environment. Now, it's become one of the, we're seeing that, and in younger people as well. Younger people. One of our youngest patients was 20 something when he was diagnosed with colorectal cancer. So can anyone hazard a guess? Why are we suddenly having more cases of colorectal cancer? Anyone?
I guess intake of meals that are less refined food, junks, and food without vegetables and fruits.
You've hit the nail on the head. It's not to suggest that that is all, but diet clearly plays a very strong role in the situation of colorectal cancer, just because this is the part of the body that food is processed. Anything you're eating will have to go through the I don't know, those of you that did biology, small intestine down to the large intestine, absorption, all sorts of different things happening there. So what you eat, we are what we eat. Whatever we eat is being processed down there. And increasingly, unlike, 20 years ago, we ate healthier. Now, lifestyle has changed. We are on the move all the time. People are dashing around, eating fast food, vegetables down there, not so much, fruits, not so much, high cost of living. People are looking for cheaper options for food. We know that carbohydrates, are cheaper. So most people will eat rice, and not just the healthy rice, which is the brown rice. Most people will eat the white rice. Most people can't afford to, have a lot of vegetables sometimes. So, so our lifestyle has changed, and that has affected our guts as well. And the fact that the cells down there suddenly say, oh, I really don't like what you're giving me. You're pumping me with too much red meat. You're pumping me with too much processed food. I can't handle it. I can't handle it. And then they suddenly just go off and become abnormal. And before you know it, somebody comes to you saying, my bowels have changed. I'm having loose motions all the time. I'm bleeding all the time. And you check, and there's a cancer seated there. So in addition to all the other lifestyle changes, we're sitting more for now, we're not exercising, we're all overweight, literally. These are all risk factors for the development of not just colorectal cancer, but for most cancers. And that will bring me down to just talking on risk factors, because we get a lot of questions from people saying, what caused the cancer? What caused the cancer? Why did this person get the cancer? If we rule out first and foremost family history, there are families that cancers genetically, it's there, whether it's breast, whether it's prostate, um, whether it's bowel. Once you rule that out, the other risk factors are down to our lifestyle. That is it. Are you smoking? Smoking is one of the risk factors that covers all cancers. It's not just lung cancer, like most people used to think that when you smoke, lung cancer. Most of the lung cancer patients we have at our facility never even smoked. So, there it is. Then there's high alcohol intake, binging on alcohol. Somebody will tell you, I don't drink throughout the week. But what are you drinking Friday, Saturday, Sunday? The quantity, when you calculate it, is over the limits. And that also becomes what we call a carcinogen. The body just has this influx of huge amounts of alcohol, and the cells go haywire. Then obesity. We know that fat cells, again, begins to affect the cells in the body. So excess weight is not good. Not being fit means that our immune system is not being boosted, because we know that good exercise, healthy diet, sleeping, these are good things for the immune system. And most of us are, this is Lagos. If I ask people what time they get up in the morning to try and get to their workplaces, and what time they leave work to get home. So you can see already there's a challenge on the immune system. There's a stress factor there, and that means that we are very at high risk. And so this is usually a wake-up call that we say to people. There are modifiable and non-modifiable factors when it comes to cancer development. Modifiable meaning that it's under your control. You just have to try and think through solutions. While factors you can't modify are those things that can change. Being female, you cannot change being female and having breasts, or being male and having a prostate. You cannot change age. We know that as people get older, there is a higher risk of developing various illnesses. You cannot suddenly become 25 after you've been 50. We know that, right? Even if you look at, you might look 25, but you're 50. But the truth is your cells are 50-year-old cells. You cannot change family history. You can't change that. So those are the things you don't have control over. But can you change what you eat? Yes, you can. Can you change your sleep habits? Yes, you can. Can you even change to a certain extent, modify to come up with, different options of how to coordinate travel? Yes, you can. They might not be perfect, but they are there. And then part of what you do for risk factors is the preventive. What do you do? So your vaccines, I talked about the HPV vaccination. That is one. I also talked about hepatitis vaccination. Most people should have hepatitis because hepatitis virus is endemic. It is here. Hepatitis B and C, and we already know that those are one of the viruses that cause liver cancer, hepatocellular cancer. So it's a question of speaking to your doctor and saying, listen, I'm 25 years, I'm male, what should I be doing at my age? Or I'm 50, I'm female, what should I be doing at my age? And that is the benefit of having a doctor that you engage with. You don't have to be ill to actually go in and make an appointment with your doctor and have a good chat. We make appointments for various other things in our lives, but the most important thing is our health, and we don't pay attention. And we don't spend the money on our health, but we can spend money on, other things. And yet, without our health, what do we have? Our health is our wealth. And that is why, for me, there's a lot of emphasis on just decreasing that fear, that whole idea that if I don't think about it, if I don't talk about it, then it disappears. Unfortunately, it doesn't disappear. So I think I've sort of done a summary here. It's not exhaustive. And so what I would suggest is probably start fielding questions, because the questions or the comments or even people sharing means that we are all learning and we can expand on that. Thank you. Okay.
Thank you so much, Ma, for such an interesting and loaded presentation. I'm sure we all have so many questions. Now I'll hand over to Borotimi for the next session. Are you there, sir? Sister Malara, are you there?
Thank you very much. Thank you, Ma, for the wonderful presentation. It has been an enlightening period. At least I've learned a lot of things I've not had before. When you started, was like, is it a medical presentation? Well, at least it's so enlightening, and but it's what we have to go through, go over again to get more enlightened. Thank you very much. Really appreciate. I don't know if you have some questions. If there's anyone that has questions, you can just unmute and ask your question. Because
I
my
have a question.
question. Okay.
I would like to know what really causes the pain in cancer, because when you have so many people who share their experiences, you hear that they've been through so much pain, So I would really like to know what is the actual cause of pain in cancer. Thank you, ma'am.
Thank you. Like I mentioned, by the time people start talking about pain in cancer, it really means that cancer has grown and is destroying tissue at the location where it is, whether it's breast or whichever location in the body. And so that is what causes pain. It's like, having a wound, a sore. What causes wounds? It's the damage, the trauma of the cancer as it begins to damage tissue, erode, and it begins to spread. So sometimes the pain people describe with cancer might be pain at the original location. So if it's breast cancer, they started having pain in that breast because the cancer is big. Now it's damaging the tissue around the breast. Or it could be the pain associated with spread, where the cancer has gone to the bone. So they are having back pain, or the cancer has gone to the liver, or it's gone to the lung. So they are now experiencing pain at those sites as well. So that's really what happens. The pain is twofold: pain at the site and pain from spread.
Okay. We have a question here, and somebody hand is up. We have a question here. At what age do you really start cancer testing?
Okay. So there are, so sorry, I thought I had shared this. So this is it actually. This is called the cancer screening guidelines. And there are only 4 cancers that can be properly screened. The others, you have to just depend on risk factors and modifying your lifestyle. But those you can actually go to the hospital and say, I'm female, I want to screen for breast, I want to, these are the 4. And these are the ages, as you can see. So from the ages of, for the breast, the ages of 23 upwards, you can actually start examining your breast. But I mentioned that as far as you have breasts, even if you're 16 years, you can examine your breasts yourself. So anyone on this forum should be examining their breasts every month. And then, you know, once you're about mid-20s, you can go to the doctors every year and have it checked out. Once you're 40, you can then do your mammogram. And then the same with the cervix. As far as you've become sexually active, actually start doing your screening. So these days, people are having sexual activities much younger. So please disregard this 21. If you've had sex at the age of 13, by 16, so you add 3 years, by 16, you should actually start having your screening done. But we've used 21 because, you know, we do expect that by 21, many people are in relationships or married or, you know, are in sexual relationships. But actually, there are young people who are having sex younger than that age. So they should start earlier as well. Then for bowel, it's 40 and above. For prostate, from 40 and above. So this is the screening guidelines. I think everybody can see it.
Yes.
That's when you should go to your doctor and say, I'm 30, I'm female, I would like you to organize all my screening checks.
Thank you, ma. Okay, the hand is down now.
It's just out of curiosity, if I may ask, Doctor.
Okay.
Because one of the things that was said, I think I noted, is the fact that a habit, especially dieting, has a way of covering up for all the possible cases of all the types of cancer. But I was just curious to ask this question: is it possible for anyone to have a multiple case or multiple cases of cancer at the same time? So by that I mean that somebody will probably have prostate and can still have the other one that we call colorectal, just at the same time. Is that a possible historical
Yeah, it is. There are families. Thank you very much for that question. It's actually a very well thought out one. There are families that have cancer syndromes. And it's, you know, it runs in the family where somebody can have both breast and ovarian cancer, or the men can have breast cancer and they can have prostate cancer as well. So that's one in terms of primary cancers. Then you also have cancers that have come up because it's spread, where somebody can come up to you and say they've been coughing, and then you do an x-ray or scan and you notice that there's a cancer in the lungs. But then in the course of investigating them, you then realize that the primary cancer where it actually started from was from the breast. So they have both breast cancer and lung cancer, but we describe it as metastatic cancer, meaning that the cancer in the lung actually came from another cancer in a different part of the body. And we see that sometimes with prostate, where the cancer spreads to the bladder because of the location of where the prostate gland is, and so on and so forth. So yes, somebody can have a cancer and have another one, sometimes just because of the spread from the first one. And then in some rare situations, rare and unfortunate situations, they can have two cancers, and then some people can have a cancer, get treated, and years later come down with a different type of cancer as well. So yeah, it is possible.
Thank you, ma. I don't know if you have another question.
We're now 24. Somebody must have a question. This cancer issue is one that is troubling many people out there. So we can't go through this stuff like we're in a lecture hall. We're not in a lecture hall, please. Yeah?
It's like your presentation solved a lot of questions. Because
No, no, no,
all
no.
my
My
questions were
presentation,
actually answered.
are you serious? Wow. My presentation was not exhaustive at all. Yeah? So please be encouraged. Let's chat. I love people asking me questions, and the ones I don't have answers, I will look for the answers and get back to you. I don't claim to know it all. We said that at the beginning. So please share or share. Other people might learn from something, you either heard or you've experienced or something.
I have another question. In cases of less known cancers, for example, like the throat cancer, what could be, I know you've mentioned the general causes, but in such a case, you wonder what could, cause, you don't drink, you don't smoke, and you still find people that, are not predisposed to these risk factors coming down with throat cancer. What would you say about this?
Difficult, because we know that cancers are so multifactorial. There's still a lot we don't know about them. But, something like throat, you've already ruled out, okay, this person isn't smoking, this person doesn't take a lot of alcohol. Well, you can have viruses, a virus like human papilloma virus, because as much as we've talked about the HPV virus affecting the cervix, we also know that when it comes to sexual, in terms of sexual, what's the word I'm looking for? Should I call it sexual styles and all? Vaginal sexual intercourse is not just the only, people have oral sex, people have anal sex. And we know that HPV have been found in these areas, not just the cervix. You have HPV in the throat as well. You have HPV in the anus, because there are people who are having anal sex, there are people who are having vaginal sex, there are people who are having oral sex. So HPV in the throat could then do exactly what happens in the cervix. So that's possible one cause. And in some cases, you never really can tell why someone has come down with a cancer when, to all appearances, they also are trying to maintain a lifestyle that would reduce the risks. So you just continue trying to reduce the risks for yourself. That's about all you can do. Make sure you're doing all the right things. And then, as we say, you then leave the rest and see what happens. So HPV is a very important cause of a lot of cancers. And just to expand on this, in some cases, then people said, oh, right, does it mean that it's only vaginal sex I can have? And the answer is that if you're sticking to the same partner, where you and your partner are each other's partner, you don't have multiple sexual partners, then, to be honest, what you do within your sex life is really fine for both of you, if you know what I mean. The difficulty and the challenge is where you all have different sexual partners, or you go through. It doesn't even mean having partners at the same time. It just could mean you're going through different partners. and you're doing all that without sexual protection, you're not using condoms, so you're at risk either way. That's where this concern is. But if you're in a monogamous sexual relationship where both of you are each other's partners, then it doesn't really matter what you're doing with each other. You're doing it with each other, and that means the risk is very minimal. Olushina's hand is up. Olushina, why don't you unmute?
Okay, yes. Sorry, let me just also make this inquiry. Because you spoke about stages, and I am aware at some point, I don't know at what point.
Sorry to interrupt. I think, yeah, okay. I was just going to say to mute. Someone was yes. So continue, Olushina.
That one of the, I don't know at what point, maybe it's the level 1 or at a higher level, that one of the treatments, I don't know whether that's still relevant now, and that's one of the reasons why I'm making that inquiry, that they do a form of therapy, that they subject maybe the patient as a point of recovery or something to a form of therapy, that maybe chemotherapy or something. And the insinuation is that at some point, it's even possible that that particular treatment triggers the spread of that cells. So I wouldn't know. That may be a myth, but that's one area I've heard something about. I wasn't so clear about.
It is a myth. So I didn't go into the actual treatment for cancer here because, to be honest, it's not relevant for this discussion. And the treatment is not just it's individualized as well. And there's so many different sub-treatments with each treatment. So some of the cancer treatments would be surgery, removal, chemotherapy, like you mentioned, radiotherapy, immunotherapy, and none of them cause a spread of the cancer. They do not cause the spread of the cancer. Why would we then institute a therapy, treatment modality that would cause a spread of the cancer? It doesn't make sense, but you see, there are so many myths out there, and especially, with social media, you can read quite a lot of things, which then scares people, and then people don't want to come for their treatments. So there are all so many different treatments for different type of cancers, for different stages of the cancer. And it's not something you can just read up and say, okay, I have this cancer, this is the treatment I'm going to have. No, it's a lot more complex than that. And that's where you have the doctors called oncologists who then drive the treatment management for any patient who has been diagnosed. That is what we do at Lakeshore Cancer Center.
Thank you, Ma. We have a question in the chat. Thanks for the lecture, Ma. Although I joined quite late, can a person diagnosed of hepatitis B or C predisposed to cancer or rather have a high risk?
Oh, yes, we do know already that one of the risk factors for hepatocellular carcinoma, liver cancer, is having hepatitis B and C. However, it doesn't mean that everybody who has hepatitis will have a cancer. Risk, if, for those of us who've done statistics, it's risk just means that there's a higher chance. It doesn't mean, it's not an absolute. It doesn't mean definitely, but it just means there's a higher chance. And that is why when you are diagnosed with hepatitis, the next step, please don't go to the church and start praying. You can do that. But please, at this point, I'm going to be very blunt. Medicine can go hand in hand with prayers. We're not saying that miracles don't happen, but we don't want this situation where we suddenly see somebody coming in with stage 4 and they tell us that when they had this diagnosis, they were well, but they were told to come for prayers. And 6 months later, they then realize that they are getting worse. So please, I just want to reiterate it here. Hepatitis is in this environment. It lives here. You'll be surprised that the next person to you has hepatitis. And it's not a stigma or anything, but it is so high in our environment that it is easily transmitted, whether it's through sex, whether it's through blood products, whether it's through fluids. So you have to go and have your vaccine. And perchance that you have hepatitis, then the next thing is to know that there is treatment and there's help again here in Nigeria. In fact, LUTH, Lagos University Teaching Hospital, has one of the best hepatology clinics that I've seen in LUTH, our LUTH, yes. Their hepatitis clinic is great. I personally have referred patients there and they have been well taken care of. So again, just to say, please don't be fearful. If you have a diagnosis of hepatitis, do not start thinking now, I'm going to have cancer, I'm going to die. No, 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 no. If you have hepatitis, please just go and see the specialist, the hepatologist. They will tell you exactly how they're going to manage you. And in the management, they reduce the risk of you developing a cancer.
Thank you, ma.
Welcome.
We have another question. Can switching completely to a plant-based sugar-free diet help a person diagnosed with cancer in terms of control and treatment?
So thank you for that question. There's been a lot of, again, social media talks about nutrition being used to cure cancer. I'm afraid I haven't seen it in practice. And we have many patients who have gone away and they've tried that. It doesn't. By the time you have the cancer, you have the cancer. You need treatment. What nutrition does is that it boosts your immune system. So having a healthy diet would just help you feel better generally. At the time of a patient having cancer, what we found is that the appetite is affected. People lose weight. It's not the time to start trying dieting. That is the time to eat most of what you can eat. Many people at that point are even unable sometimes to eat well. And it's very important that you're nutritionally well balanced. You have most of all the different elements of nutrition to boost you for the treatment, whether it's surgery, whether it's chemotherapy, whether it's radiotherapy. So that's not really the time to start trying out. All you can do is improve your diet. Make sure that, okay, I have this cancer diagnosis. I'm going to fight it. I'm going to do the best I can. I'm going to eat lots of vegetables. I'm going to have my proteins. I'm going to have my carbohydrates that help with fuel and energy. If need be, seek the help of a nutritionist so that you can come up with a meal plan that is good for you. But I have not seen the benefit of switching to a plant carbohydrate or sugar-free diet in terms of controlling the cancer. And I can assure you, there are many patients of ours who have gone away to try, and it doesn't work.
Okay, ma. Thank you, ma. We'd like to end the session at this time. It has really been an educative, enlightening, and a great session. And I will encourage all participants here to go through it. It's live on Facebook, and also we're going to share the recording with everyone so that you can actually go through it again to get more enlightened. I want to appreciate our guests. Thank you very much for your time. Thank you for the sacrifice, because I know that your day has been a busy one. Thank you for honoring our invitation. And to all our guests here, if you are not here, this session will not have been existing. This platform will not have been existing. We thank you for joining. Thank you for coming. And want to extend the invitation of the love of Christ to everyone. No, we have gathered here to get enlightened. We talk about cancer, we talk about our food, our diet, we talk about sleeping well, and we also talk about our earth is our weight. And also there is a place of God in everything that we do. So if you are here, if you not have an encounter with the Lord Jesus, please have the opportunity to give him an invitation, give him a chance in your heart. Let him have a place in it. And as lead and direct us, to show us the way we direct us. And we have also learned this day, we are not talking about spirituality alone. That is why we are bringing this topic, for people to be enlightened and for people to get to know of the importance of having this information and also acting on it. I pray the Lord will help every one of us to take heed to this message, to value our health the more, and we shall live in good health and prosperity all the days of our lives in Jesus' name. Thank you very much. And we've come to the end of this session. Thank you very much, Ma, for coming. Thank you for all our participants. We appreciate you. We're going to share the recording with you. I can also check it on live on Facebook too. Thank you very much. We've come to the end of. Thank you, Ma.
Take care. Thanks for having me, and have a good rest of your weekend.
Thank you, Ma. You too. Bye. Bye, everyone.
Bye. Thank you. Bye.
Bye.
Bye. Bye.